Hello, I'm David Harrigan, Director of Labor Relations with United Nurses of Alberta. This is our third video on the regularization process. The first two were an overview and an introduction. Today we're going to talk about innovative ways to actually implement converting the hours into regular hours. Before we get into that, though, I'd like to introduce my co-host today. I'm pleased that Janice Stewart is with us. Janice is the Executive Director of Women's Health and Surgery at the Rockyview Hospital, has been on the Joint Committee, and as well was very deeply involved in developing the worksheets and the toolkits that have been used at the local level for this process. So I welcome Janice, and I'm wondering, before we start looking at the innovative ways, if you wanted to comment on, from your perspective, what you think this regularization process brings to the employers.
Thank you, David, for inviting me today. I'm really pleased to join you to talk about this subject. I'd like to say that the employers are quite excited about the project. We've been looking forward to a process to try and stabilize some of our staffing models and to ensure that we have appropriate baseline coverage for safe patient care. We really see this project as being able to help us with that, as well as looking at opportunities to reduce some of the overtime and the extra shifts that people are picking up beyond what they would like to for their regular FTE.
Janice, I'm wondering, maybe to start, if it would be wise if you could go over the actual worksheet that the local and managers have been working with, and just provide an overview of how it's been used.
The unit work area sheet has been compiled as a summary sheet for all the work areas to submit. And in fact, this is the only required submission that each of the units or work areas are required to make to their local committees. And it's intended to be a summary of the data findings and their analysis that they've discovered for their individual work areas. The front sheet provides sort of a summary of the staff as it currently exists, the number of staff that are available, their casual staff that are available to them, and it also looks at how they've analyzed their data. What are their overtime hours, what are the number of casual hours that are used in that work area, and what are the hours that the part-timers are picking up above their regular FTE. It also looks at the staff turnover, items such as the number of maternity leaves that they've had, their vacancy rates, so that they can get a sense for how often positions sit vacant and need to be covered off through some other staffing mechanism. On the next page, it just gives a summary of whether they've had any issues with their scheduling on the unit, whether they've taken the opportunity through this project to review their actual permanent master rotations and make any adjustments for efficiencies, and then it asks them to identify the types of shifts and the shift patterns that they see that are regularly occurring that need replacement. And it's just meant to be a high-level summary and not necessarily the detailed data which they can keep for themselves. In addition to that, it has some prompting questions around the kinds of patterns that they're seeing and the variation in workloads. So for example, we know that in some areas they have a high demand for vacation requests in the summertime period, and that might be constituting a seasonal variance where they use an extraordinarily high number of casual hours or additional hours that part-timers are working during that period that doesn't occur at other times in the year. So it's really to identify regularly occurring patterns of casual staff use and additional hours that part-timers have picked up, and also their overtime use. On the next sheet, it asks them to submit some of their recommendations. So we're actually asking on their agreed number of hours that are available for regularization based on their individual analysis of the work area, and we're asking them for some preliminary recommendations about what they would like to do with those hours. So for example, do they want to create new positions? Do they want to look at some creative options that are available, such as flexible part-time? Do they want to consider float pools because maybe one individual area doesn't have enough hours and patterns to regularize, but in combination with another like area, they may see some obvious patterns that would lend itself well to a float pool solution. So those are some of the things that we're looking for from the individual work areas.
And a lot of units that I've spoken to, sometimes it's very easy. If there's hours every Monday, Tuesday, Wednesday, Thursday, you can just create a position like that. But a lot of times it's not that clear. And I'm wondering if you could go through some of the innovative answers out there. You mentioned seasonal worker, and I'm wondering if you could provide some explanation of what that's all about.
That's a good question, David. I think when we originally negotiated that option as one of the flexible options in the contract, we were really thinking about snowbirds and potentially people that would like to work during the summer months or the warm months up here in the north, but would prefer to be away during the colder months. And so they might be able to commit to a regular FTE on a seasonal basis. So for example, if they wanted to work for 6 months of the year and could commit to working full-time hours during that period, then they could take the balance of the 6 months off for the rest of the year. Their formal FTE would be a 0.5 FTE with the system. And then we would have to work out some arrangements regarding benefits, whether they wanted to prepay them for the time where they weren't earning money, whether they wanted their benefits to be through the entire year and they would pick up the cost for a portion of them, whether they want to have their 0.5 FTE salary spread out over the entire 12 months, or they want to collect their salary while they're earning it and then take a leave for the rest of the month, for the rest of the balance of the year. But having said that, we recognize that there are also other options for seasonal workers. So for example, we know that in public health during the flu vaccination season, they may have to ramp up the number of employees that they have to run their flu clinics. So that's another good area that potentially could benefit from implementing a seasonal worker option.
One of the areas, Janice, that I've heard is that a lot of locals have reported back that in certain areas there's lots of hours, but there doesn't seem to be any regular pattern. And the question is, how can we create a position if we don't have a regular pattern when the hours occur?
I think one of the solutions that may fit that type of area is the flexible part-time position. So a flexible part-time position may be a 0.7 FTE position, but maybe only 0.5 of that FTE is regularly scheduled and 0.2 is flexible. So if you have employees that are interested in increasing their existing FTEs, say going from a 0.5 to a 0.7, their 0.5 is regularly scheduled in the master rotation as it always has been, and then they commit to making their availability known to their manager for the balance of their FTE. And the manager works with them to provide them those additional shifts. So that would allow the employees some flexibility for part of their scheduling and would allow the manager to have those shifts filled that have no natural pattern to them, but potentially can be fit with an existing part-time employee's schedule.
That's great. And one of the other things that has come up is the benefit eligible casual and whether those type of positions could be used in these situations.
So the benefit eligible casual position is one that we've talked about at the steering committee provincially and had some interesting discussions around, because the project is supposed to look at regular positions, and by definition a benefit eligible casual position is not really considered a regular position. However, it may be a good fit for some areas, and I think in keeping with the spirit of the intent of the agreement, that if that's the type of recommendation that best suits that work area, then we would be happy to see them put that forward, because it is a commitment for regular hours for the casual staff to pick up. It is an agreement that if it's a 0.4 or 0.5 or a 0.6, that the casual staff member agrees to work that many hours on a regular basis.
One of the other things that we've heard is that sometimes coverage for weekends is a problem. Any ideas what innovations that could be done with that?
Certainly, one of the other options that's available in the contract is a regular option, not just a pilot project option that we put in several years ago, and that is the weekend worker. And the weekend worker was really intended to provide that additional support for weekend coverage for units where they experience a high vacancy rate on the weekends. And essentially what it is a commitment for full-time pay for actually part-time work. So the employee agrees to work every weekend, and the number of hours they work equates to a 0.8 FTE or a 0.84 FTE, and they receive full-time payment in relation to that work because they've committed to work every single weekend. Now, having said that, they also have holidays and sick time, and so those will occur on the weekends. But because of their commitment and the coverage that they provide and offer, the employer agreed to the relationship between full-time pay for part-time work.
Janice, on the worksheet, and I know that a lot of the areas, it's divided into units, and so it's a unit manager and the local representative from the specific unit. Is that always the way that it should be done, just looking unit by unit?
Our intent was for managers and their union reps to start at their unit level for sure and to have a look at their own data first. But we also recognize that there, especially in large facilities, are a number of like units where the work is fairly similar and would lend itself very well to units either matching up with a buddy unit or perhaps looking at program-wide options that meet the needs of the entire program. So for example, maybe all of the medical units at one of the facility want to get together and have a look at their patterns together and determine whether or not they could derive a solution that will work for the program, such as a float pool. Some areas already have float pools and are quite interested in expanding the number of positions in those float pools and have been very successful in getting those options to work for them. One of the other options that may be available for very specialized programs that are highly unique, and I'm thinking particularly of diagnostic imaging in their angio suites, where they might have a very few number of nursing staff, and in large centers, each of the large facilities would have a like unit like that in the diagnostic imaging department. And so it might be worthwhile for looking at cross-site coverage and whether they can create a float position that would allow them to provide better coverage for multiple sites, in which case they would be looking at a multi-site position.
Right, and along that line there's also the combined positions, which is a provision that applies in the rural areas. And it doesn't have to be a highly specialized unit, but if there's a small FTE in one site and another small FTE in another site, they could be combined as up to 3 sites as long as they're all within 100 kilometers, and that might be a really useful way for the rural areas to look at regularizing. One of the things that I hear from locals is that there's a real concern with regards to casual hours, and that's a lot of locals come back and say, well, we don't want to convert these hours because then we won't have enough casual hours. My view on that is that if enough hours are converted, you shouldn't need that many casual hours, and that one of the problems with healthcare in Alberta is the over-reliance on not casual employees, but the over-reliance on casual hours and sort of ad hoc last-minute scheduling. So one of our goals in this was to not eliminate casuals, but to provide more regular scheduling for everyone involved. I'm wondering from the employer's point of view if you have any thoughts on the casual issue.
I agree, David. There's been lots of questions around the casual staff and what will happen to casual hours and to the casual staff through this process. And it's been from both the managers and from the employees, because we have in some areas large numbers of casual staff that have been very committed to specific units. And managers are concerned in areas like critical care that if their casual staff don't have enough hours, then they are not able to maintain their competencies. However, there will always be casual hours available. It won't be possible to regularize all of the hours that occur because we recognize that on some days we have maybe 2 sick calls and other days we might have as many as 5. And so the regularization process really looks at the regularly occurring patterns and creating regular positions out of those hours. So there will continue to be some casual hours left over and available for casual staff who choose to remain casual to pick up. What they're going to need to do, though, is decide whether they want to continue to take that chance on those casual hours or whether they want to go into regular positions, because there will be those available now in the areas that they've chosen to work in. I think it will be really important as we move forward in this process and as we get closer to making recommendations for individual areas or combinations of areas that we ensure that we have a good communication plan, that the managers and their ward reps talk to the staff groups and let them know what is coming so that they have an understanding of the options that will be available to them and of the impact for their particular work area.
2 other areas that are frequently asked, at least from our point of view, is what happens if we've agreed that the hours can be regularized, but the union wants them regularized in one way and the employer wants them regularized in a separate way. I think we're both in agreement that the answer to that is the parties have agreed that the final decision on how they are regularized is up to the employer. But the second question is, what if there is no agreement? What if the union believes that the hours could be regularized, but the employer doesn't think that they can be regularized?
Yes, David, we recognize that with a project of this magnitude that, and the number of locals and the number of unit and work areas, that there is a possibility that there won't be total agreement on the actual hours that are available and can be regularized. And in the workbook, we did put in a dispute resolution process. There is a form to fill out, and that goes to the Provincial Steering Committee to assist with those issues and to help bring about a resolve. If we're unable to resolve it at that point, it is available to go up through the arbitration process for resolution.
Finally, what about the timing? What if the parties have met and they agree, hey, here's these things, they could be converted and we've now got a new position. What should members expect in terms of the length of time before they see that position actually posted?
One thing that may affect the timing of the postings for positions is actually a strategic decision not to post right away, but to wait until some of the new graduates are coming out. And so units may choose to align their postings with when they know they're going to have people coming available that are actually interested in taking the positions. For some of the more unusual options and flexible options, creative options that people may come up with, it may take a little while for us to reactivate some of the work that was done within the payroll systems to be able to make those options possible. So if we're looking at things like flexible part-time or Beckies or seasonal workers, it may be that those options will take a little bit longer for the systems to be able to align to make those postings possible. So we're going to ask people to be patient and to keep persevering until they're able to do their postings.
So it sounds like, for the same reasons you spoke about earlier, then it's going to be really important for the communication to continue and for the local and the local management to really be in close touch with each other to continue that. So it sounds like there's a lot of options out there, a lot of innovative things that can be done and are already being done. Janice, I'd just like to thank you for joining us today. And again, remind the UNA locals that if they have any questions, they can contact their Labour Relations Officer or Provincial Office.
Thank you, David, for the opportunity, and along with all of the supports that are in place for the UNA local representatives and the committees, Alberta Health Services also has zone support groups available through their HR services reps that have been assigned in each zone.